Hello, my name is Danielle McAllister, and I'm a teacher at Bemidji Middle School, and I'm going to show you my presentation. And I'm going to be speaking to you about speech patterns and communication challenges in students with ASD. As we know, ASD students have struggles in communication and speech and language, and some have very limited speaking skills. The failure to meet language development milestones is one of the earliest red flags for autism. Children with ASD are often self-absorbed and seem to exist in their own private world, and this limits their ability to successfully communicate and interact with others. Speech patterns can affect communication for students with ASD, as we know, so they have a general lack of social awareness oftentimes, and this can show up by being unresponsive to social cues like waving hi. They may have an inability to focus on same objects with someone else, in joint attention. And students with high-functioning autism, classic and severe forms of ASD, can have significantly impaired language and communication skills. So it's important that we work with our speech-language therapist to determine what needs need to be met for them so that they can bridge the gap between their deficits and getting their schoolwork done, getting their social interactions met. And the ways in which atypical speech patterns in people with autism are described are often monotonic, sing-song voice, machine-like, language delay, being non-responsive to his or her own name. Echolalia is common, repetitive usage of single words or phrases. And neurotypical society places an enormous value on tone, inflection, and speed and pattern of speech to convey meaning and emotion. The deficits in receptive and expressive language can manifest in students with ASD environments. Children with ASD have receptive and expressive language impairments. Children with lacking receptive language are shown to be less confident, have lower attention span, a reduced social drive to talk, and may manifest as something delayed or impaired in this language development. Receptive language specifically is when, if they don't have great receptive language, they don't understand what others say. So it's important that we understand that they may have deficits in this area, and they may become easily frustrated when their focus or play is interrupted. They may require extra help to follow directions, and having troubles organizing their thoughts can happen with both speaking and writing. Along with the receptive language, they also have expressive language delays as well. And an expressive language delay doesn't necessarily affect how children say things, but what they're saying. They may talk very little for their age. They can be frustrating for a student, caregiver, or teacher because it seems like they're having a temper tantrum because they can't express how they're feeling, and it leads to behaviors. And the most common difficulties students have with ASD are in the areas of social, communication, and behavioral. Their social skills are going to be affected, and this is one of the impairments that is very common to a central feature of ASD. Their communication is often going to be repaired, and a speech-language pathologist will perform the comprehensive evaluations of the child's abilities to communicate and will design an appropriate treatment plan for them. Also, their behavior is going to be affected, and often when a student can't meet their needs with verbal communication, they'll turn to behaviors to get their needs met. The speech language pathologists and service providers will be the ones that help with this deficit in the area of both expressive and receptive, and to try to curb some of these negative behaviors and encourage social skills. Assessments usually are conducted by the SLPs. They'll identify language challenges. They'll treat the symptoms and communication deficits and often meet with the students and families to ensure that the proper communication supports are in place for both academic and non-academic environments. When students aren't having a good time at school with communication, oftentimes it shows up in bad grades. It shows up in behavior issues, and teachers will use intervention techniques such as evidence-based practices to help them to get their point across and to help them understand how to communicate in a more effective way. And knowledge is power, and that helps ASD students tremendously. Well, thank you so much for coming to my presentation, and I will have my references listed here as well for you. Thank you so much.